Asthma is a long-term inflammatory disease of airways of the lungs. Usually, with every breath we take, air goes through our nose or mouth and goes down into our throat, into our airways, and ultimately making it to the lungs. In our lungs, there are plenty of narrow air passages that will help bring oxygen into the bloodstream from the air. Symptoms of asthma arise when the linings of the airways are swelled and the muscles are contracted around them, which is called bronchospasm. The airways are then filled with mucus, further decreasing the amount of air that can move through. This can make breathing difficulty, trigger coughing, a whistling sound when we breathe out, and shortness of breath. Severe asthma can trigger difficulty talking or being productive. The exact cause of asthma is still unknown and the causes can differ from person to person. Instead, the researchers believe that the breathing condition is caused by a variety of factors. It is suspected that asthma is caused by a combination of genetic and environmental factors such as allergens, air pollution, and other environmental chemicals. Other possible causes include medicines such as aspirin and beta blocker. Moreover, family history is a risk factor for asthma, with several different genes involved. If a parent or siblings has asthma, we are more likely to inherit it. How often signs and symptoms of asthma occur may depend on how severe or intense the asthma is and whether we are exposed to allergens. Some people have symptoms every day, while others have symptoms only a few days of the year. For certain people, asthma can cause irritation, but it does not interfere with everyday activities. When asthma is well managed, there are only a few symptoms. As symptoms escalate, a person may have an asthma attack or exacerbation. Over time, untreated asthma can cause damage to the airways of the lungs. Signs and symptoms of asthma can include shortness of breath, chest tightness or pain, wheezing when breathed, trouble sleeping because of breathing problems, coughing especially at night or in the morning, when laughing, and also during exercises.
There is no cure for asthma. Symptoms can be prevented by avoiding triggers such as allergens and irritants. Treatments for asthma fall into three primary categories such as breathing exercise, quick relief asthma, and long-term asthma control medications. Firstly, exercise will help us to get more oxygen in and out of our lungs. Over time, this can help improve lung capacity, reduce serious symptoms of asthma. Besides, short-term relief medications, also known as quick relief medicines, help avoid symptoms or alleviate symptoms during an asthma attack. They may be the only medications required for mild asthma or asthma that only happen with physical exercise. For example, bronchodilators. Bronchodilators functions in a matter of minutes to loosen the tightened muscles around the airway. They can be used as an inhaler or nebulizer. Last but not least, long-term asthma control medications. This treatment will be taken daily. It tends to reduce the amount and severity of symptoms of asthma, but they do not control the acute symptoms of an attack. For intense anti-inflammatories, it will be taken with an inhaler, corticosteroids, and other anti-inflammatory. Medications help reduce swelling anti-mucus productions in your area, making it easier to breathe. The objective of this case study are to increase public awareness of asthma as a significant public health problem and its signs and symptoms. Second, to improve development, disseminations, and use of patients and family education materials. Third, to improve the knowledge, attitude, and skills of patients regarding the detections, treatment, and control of asthma. slightly is we want to clarify the problem asthma and how it can affect the human daily life. Asthma could affect the vessel to be swollen, slow down the circulations of oxygenated blood from the lungs to the heart, and no blood could pass through the vessel that could affect the overall circulation system. The technique that we will use to better analyze the data is using Google Form to create questionnaires. The Google Form will be shared to our social media account such as posting it to representatives and Instagram story to distribute the questionnaires to the respondent.
According to a CDC report, parents that diagnosed with asthma most likely is going to inherit that to their children. According to our data, out of 50 respondents, 18 of them diagnosed with asthma. And there were 31 respondents that claimed their family members also have asthma, which means asthma is pretty common in our community. Out of 50 respondents, 37 respondents claim that they know the definition of asthma, but then 31 out of the 37 respondents, 31 of the respondents answered it wrong, where they answer the asthma is actually a common heart condition, which is wrong. 17 respondents answered that the cause of asthma is due to respiratory infections, followed by airborne allergen, physical activity, cold, and animal fur. The remaining 3 respondents does not know the cause of asthma. According to the World Health Organization, asthma can affect all age groups, but most likely going to start developing during childhood. A total of 39 respondents state that they know the symptoms of asthma, but while the remaining remain clueless. Most of the respondents answered breathlessness as the symptoms of asthma, followed by the other 10 respondents answered all the symptoms mentioned in the data, which includes coughing, fainting, blue fingers and lips. There were 31 respondents know the treatment for asthma, meanwhile 19 of the respondents does not know what is the treatment needed. 28 respondents agreed that the treatment for asthma is by using an inhaler. Another 17 respondents answered that they should be taking medicine, and the other 5 respondents does not know how.
For the discussions, according to the data obtained, 18 respondents happen to have asthma while 32 of them does not experience it. It shows that 36% of the 50 respondents are struggling with asthma. There were 31 respondents that have their family members struggling with asthma as well. This proves that asthma is genetically inherited. According to the CDC report, if a person has parents with asthma, they are 3 to 6 more likely to develop asthma than someone who does not have a parents with asthma. Out of the 50 respondents, 37 of them claim to know what is asthma, but 31 of them choose the wrong definition of asthma. The correct definitions of asthma is the common lung conditions that causes occasional breathing difficulties. Majority, 17 of the respondents, choose the causes of asthma is due to the respiratory infection. 39 of the respondents know the symptom of asthma, while the others does not know the symptom of asthma. Most of them choose breathlessness as the symptoms, and 10 of them choose all of the mentioned symptoms such as breathlessness, coughing, fainting, and blue lips and fingers. According to this data, can be concluded that the respondent does not have wide knowledge on the asthma disease. This is because only 10 respondents choose all the mentioned symptoms. For the treatment of asthma, 31 of them know the treatment needed, 28 agree by using an inhaler, followed by 17 respondents choose taking medicine. The aim of this study to increase public awareness as a significant public health and its signs and symptoms. Surprisingly, 18 out of 50 respondents happen to have asthma in our community. It shows that asthma is a common disease in our community, hence awareness should be applied more in our society. A study conducted by Ndarukwa, Chimbari and Sibanda, development of frameworks for increasing asthma awareness in Chitung Visa, Zimbabwe. By bulk messages via network operator, the public consciousness can be improved. Also, multimedia can be used to enhance public understanding of asthma. In other studies, shows that local news media can be efficient partner for disseminating asthma messages. The use of local televisions and radio talk show to host asthma awareness program to the viewers, and social media to spread and share information of asthma disease. In the study they have conducted, there were respondents that gave brilliant answer to spread awareness to the public, such as include ways to have asthma attacks in school syllabus. And majority of the respondents respond with organizing an awareness campaign through social media platform, which include proper management and treatments. The results obtained are valid but inaccurate as they are inconsistent answer from the respondent, such as the respondents claim to know what is asthma, but majority choose the wrong definition of asthma. This is due to the lack knowledge of the disease. In addition, based on online forum managed by Dr. Sri Vignarajan, the symptoms of asthma are the sound of wheezing during breathing difficulty. The causes of asthma is unknown. However, it may depend on genetics, environmental, and individuals. Some causes that trigger the asthma symptoms are exposed to smoke, polluted air, allergens, cold and dry weather, stress, infections of the respiratory, and others. Risk factors may include hay fever, genetic, and eczema. Moreover, ways on how to prevent asthma other than medications are quit smoking, minimal exposure to smoke, treatment of conditions like allergic rhinitis, and gastroesophageal reflux disease treatment can increase the prevention of asthma, and also vaccination. Next, for the treatment of asthma, after the causes of asthma has been identified, then specific treatment can be given to the patient, such as bronchodilators, immunotherapy, inhaled steroids, inhaled corticosteroids, anti-IgE, anti-IL-5 treatments, and many more, depends on the causes.
In conclusion, there are 5 parts that includes in this study. The first one is causes, symptoms, treatments, recommendations, and survey. So let's go through one by one with me. The first one is causes. So in the causes, there are 3 main parts that included in asthma. The first one is environmental, family, and medicine. For environmental, allergens and air pollutants will lead people that having asthma to have a respiratory infections. As for family, it actually usually from genetic, and medicine is from taking more than usual medicine. Next is symptoms, that is breathlessness, coughing, and fainting. So for breathlessness, this means like when people having asthma, they tend to have a breathlessness moment. So means here they didn't get the amount of oxygen that they needed for the body's function. So they feel stuck like that. And for coughing, they tend to coughing because they need oxygen from surroundings to feel breath. So they need to cough to take oxygen. And the last one is fainting. So when this happens, this means the oxygen, the amount of oxygen doesn't enough for the whole body. So people of having asthma tend to faint. So for the treatment, there are two, that is inhaler and medicine. So for inhaler, there are two types of inhaler, the color of blue and brown, which considered as preventers and relievers. So these both are used when people are getting asthma or before they're getting asthma. And next one is taking medicine. Next one is survey. So we have conducted a survey about asthma disease through Google form and share it to the community. And we have 50 respondents of this survey. And from the answer of the respondent, we have made it into a results, a graph bar chart. So as you can see, my friends already presenting about it. And the last one is recommendation. So what we would like to recommend for other people to increase the awareness of this asthma disease. As we know, the asthma disease is not a small disease in Malaysia. It is like a common for Malaysian to have an asthma. So we need to increase the awareness through using a range of technologies. Using the range of technologies, so from this we can do a TV talk show where we invite an asthma educator and he or she can share more about asthma where people doesn't know about this. Next, we can do an infographic poster also and posted it in media, in social media, where younger people nowadays and also older generations use it. So people loves to share information, share knowledge. So with these little tiny informations, people can know where they read it, so people gain more knowledge about asthma. In the nutshell, the objectives in this study were achieved through Google form and interview with the respondents. We have completed this survey and make it into a full report and video presentation for you. So we hope that people around will have a new value of themselves in knowing about asthma. Thank you.